Okay, and welcome to the PACIO Advanced Directive Interoperability track at the May Connectathon. What we'll be doing today is demonstrating sharing the information throughout multiple systems as we go forward. So to bring everyone up to speed, previously in January, the Advanced Directive Interoperability Group of PACIO demonstrated sharing a blob of information, so a scanned document that had been brought into a server that was for our patient, Betsy Smith-Johnson, that she ended up making an advanced directive on her birthday. Again, it was just a basic paper document that was scanned into a system and then shared with a long-term service agency. In this Connectathon, what you see here are the system players that will be sharing the information. You'll see that it starts with the creation of the information that'll be put into a server that'll be then viewed by a client and then also sent to another server where that information will be able to be retrieved by individuals and then used throughout the continuum of the story. What we'll do now is go into each detail specific for the patient and walk you through the patient scenario. So here in scene 2, we're starting off with Betsy Smith-Johnson. She's decided she wants to go update her information. She's updating her information in a system called My Directives. And what she'll do is she's going to take that same information she had previously just on a piece of paper and put it into a more digital form. That digital form will be able to share more discrete information about her healthcare information and then put it in a repository that'll be a custodian of that information that then can be shared to multiple different groups and then also be queried to be looked at. And what we'll be demonstrating here is that creation of the information and it being in a server and then a client that will retrieve that information, request that information, retrieve it, and be able to display it. Yes. So what you see here is you see within the Advanced Directive repository, this is just something we're showing for understanding of use. You'll see that there is no information here. So we're going to import a document so that the My Directive system takes the CDA document. So what we're doing is we're going to make that CDA document, take the CDA document and drop it into the system. Once it's dropped into the system, we will digitally seal the document so that the CDA document cannot be changed in any shape, form, or fashion and import that information. We can see here that there's a digital signature on the document, and we will now share that, show that it's been saved as a FHIR resource, and here's a demonstration of it being saved within AD Vault's registry repository. And what we'll demonstrate is Charles, the son, looking at the information. Let's say that Betsy's decided to let her son know. She has updated her advanced directive information, and now he's going to look at that.
All right, so here we have Charles accessing Betsy's advanced directive. And, we can see, obviously it's a personal advanced care plan, the date she created it, that indeed the author of the plan was Betsy herself. It includes her demographic information. And then we show the custodian here as well. And so in terms of the agents, the way this is broken up is when there is discrete data, we're showing it in this kind of more formatted format versus this is the clear text when it does not include the formatted data. So for healthcare agents, we do in fact have the healthcare agent's information summarized. We're also showing in this presentation the text that was sent as well. So in this case, her primary healthcare agent is her son, Charles, and that first alternate is her daughter, Deborah. All right, and then going on, so these are the goals and preferences for care experience. And we can see each of these. So in her likes and joys, these are things that would keep her happy and relaxed. So she really loves the smell of lavender and the feeling of sunshine on my face. She has certain dislikes and fears. So she really does not like her feet to be cold. Issues around how she likes to be cared for. She'd like to have photos of her family kind of prominent where she can see them easily. In terms of her religion, we'll jump down here. We see that she's Catholic. And in fact, she says, please call Father Mark if my condition warrants the services of a priest. In terms of unfinished business, she's called out the fact that she would really like to see her sister again before she passes. She really misses her, and she's really sorry for the disagreements they've had in the past. In terms of laughter, she says, my dogs make me laugh when they play together, and my grandchildren make me laugh when they put on plays for me. They bring me great joy. So going on down, Charles looks at her advanced care goals, and she says she would like to avoid prolonged dependence on machines. She would like to not be a physical burden to her family, and she prefers to pass at home. And then in the text, we have other instructions as well. Then she has her preferences upon death. So she's giving consent to donate all of her organs and tissues. In terms of an autopsy, she only wants an autopsy if there are questions about her death. And in terms of her thoughts and plans on burial plans, she'd like you to please call Jim Houston, her lawyer, and she's given him all the details of the arrangements that she'd like to have made. And then we have all the witness and notary information as well. And of course, Charles reads this, is really glad to know all these details about his mother's preferences, calls her on the phone, says, okay, I've read your advance directive. I'm so glad to receive that. And Mom, these things sound just like you.
Scene 3, what's happening here is the AD Vault system will send information to the MyHIN server. What happens is Charles says, since Betsy, you're going to be coming to visit me in Michigan, why don't you go ahead and send your advance directive information to our local health information network. And then what we'll show is once it gets there, Betsy, wanting to make sure and using her right to access information, is going to look up and then query the health information network in Michigan and look at that information. So what we'll see is the information being pushed from the AD Vault server into the MyHIN receiver, and then it'll also be queried by the MaxMD client from MyHIN. Okay, so here's where we left off. What we'll do is we're now going to send that advanced directive information to the Michigan Health Information Network. We'll see that that information has been sent. And now what we'll do is show Betsy looking up that information. And then Keith is going to walk us through using the app, and I'll add in any of the details about the scenario.
So here is the consumer-facing MaxMD app. The user will log in first. So here is Betsy Smith Johnson on the homepage of the MaxMD app. First, we have to go into the care team and organization's address book. See that the MyHIN open server is available for her to query. So we're going to go into the record retrieval module. And here we're going to be searching for clinical information. We're going to select the MyHIN open server. And for either clinical data or clinical documents, we're going to do a document query for the advanced directive and confirm the selection. Once we've executed the query, the document will come back into Betsy's record archive. We can look at the archive, go over to clinical documents, see the documents that we've retrieved, and render the advanced care plan.
And what you're seeing here is the specific information. And again, most of this is broken out into the text of the section information that we've identified. There's your goals, preference, and priorities that were explained before that Nancy went into great detail about. The primary care agent, your first alternate, as well as the detailed information from there. Witness and notary information as well. And Betsy's looking at all that information and realizes that is exactly as she had put it in previously. So in between, when Betsy looked at her information, there was a update from the AD Vault system, and more specific data entry or data specific entry information is now being shared with MyHIN. And what we'll show now is that information, it was pushed from the MyHIN server to the Alterum server because Betsy unfortunately had a medical emergency. When she had this medical emergency, she is no longer able to communicate as she was before. the hospital EHR is going to retrieve information from the Alterum server, and we'll see more specific information that's displayed there. So again, Betsy is had a medical event. She's not able to share her wishes, and the hospital wants to look at what her wishes are and have a better understanding of what's going on and what her wishes are.
And one thing I'd like to mention is before her medical event, and since that last scene, the document was updated with some more discrete information that's available on the MyHIN server, so it was updated. So here we have some MITRE reference implementation. It's just a pseudo EHR to show this data being available. Connect to the Alterum server. This reference implementation covers a number of use cases or guides. So go to the advanced directive and I'll pull up the one that was related to the latest update. And here we see the patient with their healthcare agents are identified, some of the wishes, the preferences, care preferences that Betsy has. And then here we have a set of priorities for the patient that need to be considered for care.
Okay, so our next scene, Betsy's going to be discharged to home. She's going to receive home health services. And what we'll be showing here now is that information being pulled into that home health agency's services. Again, Betsy's still having difficulty communicating with her caregivers, so they're going to continue to look at her advanced directives and listen to Charles about what those wants and needs may be.
So here we are at the home health agency. And where we want to be accessing Betsy's advanced directive. So there's a couple of scenarios in a production environment where this might make sense. So this could actually be a screen in the EMR, or it also, some home health agencies don't have the most up-to-date EMRs. So it could also be a Smart on FHIR screen. And it could be either a standalone web app, or it could be pulled into the EMR either through a CVS hooks link or through a tab in the EMR that allows you to pull in a Smart on FHIR app. So any of those might work. So as well as a hard app, which we implement through patient sharing. Okay, so here we are at the advanced directive. We've just pulled this data from MyHIN. We have the summary information. We see it's a personal advanced care plan, particularly the advanced directive, the date it was created, the author. And this is much the same as what we demonstrated a little bit earlier, but here you're seeing that most of the data is presented in discrete data. So we have each of these discrete data points. We have all of her demographic information. We have her healthcare agents, both her primary and her alternate. So obviously her son Charles is the primary healthcare agent. We have specified the patient goals, preferences, and priorities for her care experience. So again, I guess I won't go through each one of these, but again, she likes the smell of lavender. She doesn't want her feet to be cold. She wants, photos of her family where she can see them. She talks about her religion and calling Father Mark, the unfinished business with her sister, and then things that make her laugh. And again, under goals, priorities, and preferences under certain health conditions. So again, she has each of these preferences. She would like to have them keep trying life-sustaining treatments until her healthcare agent, her son Charles in this case, makes an alternate decision. In terms of CPR, she also wants to rely on her healthcare agent to make that decision. And for her final days, she's very clear she'd like to remain at home if possible, and she'd like to receive hospice care at her home. And then her goals, would be, avoiding prolonged dependence on machines, not being a physical burden to her family, and then dying at home. And then we go down to her preference and goals upon death. And again, in terms of burial plans and funerals, she's given all of that information to her attorney, Jim Houston. She wants an autopsy only if there's questions about her health, and she does consent to donate her organs and tissues. And then again, the last section, and this is only not in structured data because the IG just hasn't put into structured data yet, but this is a witness and notary information, so we're showing the text version of that data. So that's the complete advanced directive on Betsy.